Well, welcome back, everyone. Today we are joined by Lima Memorial pulmonologist Dr. Jason Stienecker to discuss some of the impressive and life-saving advancements Lima Memorial brought to the community to impact the fight against lung cancer. So thanks so much for joining us.
Thanks for having me. I appreciate it.
Yeah, so I understand that locally we have made a lot of strides in diagnosing early-stage lung cancer. So can you share a little bit more about that?
Yeah, absolutely. So we started our low-dose lung screening program many years ago, and since that time we've been able to reduce the amount of advanced stage lung cancers down to a minimal percentage. And so most of our lung cancers are now being diagnosed at low stages, which helps outcome and patients be able to get through the diagnosis and treatment process much easier.
All right. So what results have you seen in diagnosing those early stage lung cancer?
So we've had a lot of good success. We started robotic bronchoscopy combined with cone beam CT scan. So essentially a CT guided bronchoscopy now for about 3 years. And since that time, we've been able to diagnose smaller and smaller nodules. And our success rate is around a 98% accuracy with biopsies to get a diagnosis, as well as improving our low dose, our low stage cancer diagnosis to about almost 60% of our patients are now being diagnosed in the early stages.
Wow. So early detection is important, of course, for all forms of cancer, but especially lung cancer. But why is this the case?
Unfortunately, with lung cancer, it has a sharp drop off in the 5-year survival curve past low stage versus breast cancer, colon cancer, et cetera. Lung cancer does have the highest mortality rate, unfortunately. And it's simply because lung cancer really doesn't give you symptoms until it's in the advanced stage. There's no real pain fibers within the lungs. So until you start having a cough or weight loss or coughing out blood, we don't really know anything's going on. So really early screening helps find these nodules that could be cancers before they're going to be causing you symptoms in the early stages.
Right. So if someone is concerned about lung cancer, how can they reach out?
So I recommend talking to your family doctor. Obviously, I always tell every patient, please quit smoking. It's one of the primary drivers of lung cancer. But reach out to your primary care provider. They can set you up with a low-dose screening CT scan if you qualify. And you can always have them or reach out to our office as well here at Lima Memorial Pulmonary.
All right, fantastic. Well, thanks so much for joining us today. I really appreciate it.
Absolutely. Thanks for having me on, and I hope everybody quits smoking.
All right. Well, don't go away because we have more to be returned.